WNYT Albany in HD. Weekend Today begins right now.
Welcome back. While we may have passed the peak of flu season, don't let your guard down yet. Flu season actually runs until April. Dr. Liza Whalen from CDPHP is here with some tips to keep you healthy. Doc, good morning.
Good morning, Dan.
Well, we just saw a video about, I would say about 3 minutes ago, how this thing can spread so fast. You know, flu, the cold. Tell us technically, give us, break it down for us. How do you get it from just in your hands and into your system?
Well, first thing is that influenza is primarily a respiratory virus, so it's something that affects the lungs, and it is spread through two main forms, usually droplet infection or particles in the air. So in order to get influenza, you have to inhale these particles, and if someone is coughing, it's possible that they can cough onto surfaces, and when you touch these surfaces then you can get close to your hands or mouth, and that's another way that you can catch influenza.
So don't touch your face.
That's a good, or wash your hands.
So it's that easy. If someone is sneezing right next to you, let's say in the office, and you breathe it in, and that's it, you're catching it.
Well, it's possible, and there are certainly a lot of factors that come into play, whether you actually catch the flu because someone next to you sneezes, but that is certainly one way you can catch it.
This is very hard to prevent, isn't it? I mean, it's one mistake, and there it is. You're done.
Well, it can be hard to prevent, but there are certainly things that you can do to prevent it.
Absolutely. We're going to go through them right now. So, to prevent catching the flu or the cold, right? So this is for both.
Well, yes, you can talk about practices to prevent the flu and the cold, but really when you want to start talking about preventing the flu, the first thing that we should talk about is the virus, the vaccine for the flu.
Okay, so the flu is a virus.
That's correct.
And the cold is also a virus.
That's correct.
What is the bacteria? There's like a different...
Well, bacterial infections are often transmitted the same way, but they're just a different type of organism.
Okay.
And treatment is different for bacterial infections.
Okay, now let's get through how you prevent this. So first, get a flu shot. That's like the biggest thing,
right.
Isn't it?
And that's the single best thing that we have available to prevent the spread and getting the flu, is to get immunized. And even though it's February, historically the peak month of flu transmission is February, so it's not too late to get a flu shot if you haven't.
Yeah, I was just going to ask you that. So not too late. Get it now.
No, it's not too late.
All right. Second, wash your hands.
That's right.
So flu shot, wash your hands are two top things.
That's right. Hand hygiene is very important, so you want to make sure that your hands are clean. It is very difficult to control the surfaces that you come in contact with, but you want to make sure that you keep your hands clean so that when they do come in contact with your face, you don't have any, you lessen your chance of getting infection.
How many times do you do that before people start thinking you're OCD, Doc?
Well, I mean, it certainly varies for different people, but you should try to wash your hands before you eat. That's generally a good principle. Or if you've been in a very crowded environment, if you've been in a congregate setting where you know a lot of people are, if you've handled things like doorknobs coming in and going out of public places, it's always a good time to think about it then.
So if you have it already, cough or sneeze into your elbow.
That's right. It's very important if you have the flu to stay home, first of all. And you really want it, because it is so communicable, you want to be able to keep yourself at home and stay at home until your fever has been gone for at least 24 hours. So that's the first step.
Right.
And then when you're coughing, it is better to cough into your elbow because obviously you're not coughing into your hands and you lessen the chance of passing that onto a surface.
Okay, and then most of it is going into your elbow, or is it still going in the air?
Well, it's both.
All right, and know who is at high risk. Why is that important?
Well, it's important to know if you're at high risk for the flu, first of all, to consider for vaccination. But secondly, if you're at high risk, and people that are at high risk for complications for influenza are the very old and the very young. They're people that have coexisting medical illnesses, such as asthma and heart disease, and pregnant women are another important group. Individuals like this, if they have symptoms of the flu, should consider contacting their doctor early because there is treatment. There are antivirals that can help shorten the duration and the intensity of the flu.
Dr. Liza Whalen from CDPHP. Very good advice this morning. I will be washing my hands a lot more, I got to tell you that.
Thanks, Dan.
All right, thank you so much for being with us this morning. And for more information, we've set up a link on our website. Just go to WNYT.com and click on News Links.